What are the benefits to you as a hematologist when your patient is in a shared care setup at a MDS Center of Excellence?
Well, we as an MDS Centre of Excellence, we share the care of many patients with the referring hospitals, and it usually works very well. So there are a number of circumstances in which we do that. For clinical trials, we have to see the patient to do all the trial-based assessments and give the investigational product. We have to see them in our centre, but they can receive all other care in their centre. So we share the care, for example, in patients who are on blood transfusions, and we're giving them treatments that may improve their blood transfusion. That has to work well because the trial depends on that interface working smoothly. And the clinical research nurses, the clinical research staff, are liaising constantly and with nurse specialists, as well as the doctors liaising with the doctors. So that's a well tried and tested. For patients that I see for sort of specialist opinions, we have some patients who like to come back repeatedly here and go back to their own hospital. And what they do then is we basically make sure that they're not duplicating efforts. So we make sure that they have a reasonable interval between the visits to their other hospital and to our hospital. We maybe see these patients every 6 months here, and then they're seen every 6 months in the local hospital. So there's a group of patients, generally the younger patients who could at some point be considered for transplantation, who we perhaps see intermittently in the specialist centre. We test their bone marrow intermittently, and we'll see them with the detailed results. That's one example. And then there are others, obviously, who come because they just want to keep in touch with us, as well as have all their practical care delivered locally. And as long as the written communication stream is good, and where necessary the verbal communication stream is good between the medical staff and the nurse specialists, then that all works very well.